This Headless Professor video is not just about Obamacare, but it is also about some of the basic principles that we use in the critical thinking class. Today, our Congress must decide whether to move forward with the various versions of health care that have been approved by one house or the other, or to stay with the present system, the status quo of our health care program. It appears that we have a dichotomy. We must choose between only two choices: the Obamacare proposals or the status quo. Now, this is actually an example of what we call a false dichotomy, which assumes two and only two possibilities, because in reality there are other kinds of proposals for healthcare that we could and should be considering. And perhaps one of these other proposals would be a better pathway. In order to get an idea of what a better proposal might look like, perhaps we should reframe what we're thinking of and get a fresh perspective on this. I would propose that we focus on our future goals and let that guide us. What do we want from a healthcare system? Well, first and foremost, we want to preserve the quality of what we have today. A very good healthcare system with advanced treatment. But we also need to control many of the costs that we have. And we want to avoid the problem of undercoverage, so many Americans without health care coverage. I think another major concern should be to reduce the burden on employers that discourages them from hiring new workers for fear that they're going to have to merely assume the responsibility of providing health care. With this in mind, the idea that we've got to reduce these problems in the present system, I have a third proposal that I think is better than Obamacare and better than the status quo. And I'm going to show you how we can get to a much better program in the future by looking at this third possibility. Specifically, I say let's fix Medicare. And here's how. First step in fixing Medicare, let's stop the $1 billion worth of fraud that's there today. Secondly, let's cut out the middlemen, the insurance companies that are brokering many of the Medicare policies, where their executives are making millions of dollars worth of bonuses and the companies are making billions of dollars worth of profits. Third, let's have tort reform. The trial lawyers are making too much out of the current Medicare situation. And unfortunately, Obamacare does nothing to stop this drain on the program. Fourth, let's reduce the employer burden and the payroll tax burden of Medicare by transferring the financing of Medicare to a national sales tax. These things would meet many of the problems that we've talked about so far. The problems of cost and the problems of inadequate coverage. But the best way to overcome inadequate coverage is step 5 in Medicare. Extend Medicare to cover everyone. Once we've done those 5 things, we've fixed Medicare, and essentially, we've solved the problems of the present system: the cost, the burden of the employers, and the inadequate coverage. Indeed, I would say to the advocates of Obamacare that if we cannot fix Medicare, then we cannot get comprehensive health care right. Well, that last statement is a simple modus ponens, but I think it shows the way, a better path for reforming health care.